This video will cover the steps for how to order IV fluids using the new order entry component within an M page. There is a clinical risk around this process, so it's important that all steps outlined in this video are followed. This will ensure that patients receive a specified volume of IV fluids and reduces the risk of them receiving unintended or excessive doses of IV fluids, which could lead to patient harm. To start, log into PowerChart and select your M page that you wish to use. I'm going to use the Manage M page for this video. Using the component menu on the left-hand side of the screen, select New Order Entry, and within the search bar, start typing in the name of the fluid order that you wish to prescribe. As you type, the list of associated orders containing that phrase will show in the table below, and simply single click on your order and you'll see that it has activated the Orders for Signature icon. Click on the Orders for Signature icon and select Modify Details. This brings us to the Orders for Signature window, and we simply click on our order and you can see that that brings up the order entry details for the fluid order. We have 3 yellow fields which are mandatory, which are bag volume, rate and infuse over time. Start by entering your bag volume, and if you select enter on your keyboard, you'll see that that means that we've satisfied the mandatory criterion here and the yellow field has now turned white. For rate and infuse over time, you can enter one value into one of these cells and the system will calculate the other one for you. So if I enter an infuse over time of 8 hours and select enter, you can see that the rate has been calculated for us. Although we've satisfied the mandatory criteria for this order, there is an additional step that we need to take to specify the duration of this order. If we were to sign this order off now, this would create a continuous infusion for this order. This means that after the first 1000 milliliter bag had been administered over 8 hours, a subsequent 1000 milliliter bag would appear in the medication administration window for nursing staff to administer. And this process would continue until a doctor went into the patient record and discontinued this order. It's therefore essential to specify the duration, as in the number of bags that we want to prescribe for a patient, in line with good clinical practice, to ensure that we are not ordering excessive volumes of IV fluids and putting the patient at risk of harm due to fluid overload. To specify your duration, you need to navigate to the Details tab. And you may be prompted at this point just to confirm the route of the infusion, so I'm going to select intravenous. You can see that we have 2 fields, duration unit and duration, which we need to complete. And while these are not mandatory at the moment, we will be making changes to mandate duration and duration unit in the future. Using the drop-down for duration unit, select bags, as bags are how we prescribe fluids at UHCW. You can see that after specifying our duration unit, the duration field has now become mandatory because it's yellow. Enter your duration unit, so the number of bags that you wish to prescribe. So I'm going to put in 1 and I select enter, and you can see now that we have a start date and time for our order, which corresponds to the time that I'm placing this order, and that the stop time corresponds to 8 hours after the start time. So we know that specifying the duration means that there is a stop time for this order. Once this order has been administered by the nursing staff and has been completed and ended by the nursing staff, it will drop off the drug chart and move to the discontinued section of the drug chart, so will not be a continuous infusion. To complete this order, we would hit sign. And then as we have prescribed something, it's always good practice to go to the drug chart and check that our order is charting as it should. In line with good clinical practice, we shouldn't be prescribing IV fluids for extended periods of time without a clinical review of the patient and their parameters to make sure that we are safely prescribing IV fluids. Please check the QRG, which is available on eCoach, for the steps for this process.